I'm Dr. Tom Naro from MyPT. I'm going to show you 3 highly effective treatment techniques that I use with my clients on a regular basis. Now, these techniques are aimed at making a difference in muscles, fascia, and nerves. I'll explain during the videos because you'll see me working on a client and I'll be commentating. If you have any questions about what you see or something else that you'd like to watch a video or learn more about, feel free to contact me at info@mypt.us. And I'd like it if you could go to our website, www.mypt.us, and sign up for our newsletter. You'll be able to have advantage of watching future content and learning more about what MyPT offers for our clients so they can heal better, live better. The first treatment technique that you're seeing here is the Theragun G3 PRO. This is percussion therapy using a battery-operated hand tool that's ergonomically designed to make treating clients easier for me. Now, this helps to ease muscle tension and tightness, and that results in better flexibility and even strength. When muscles are tight, they're actually shortened. And if you think of a rubber band and you pull the rubber band apart, there's tension on it. But when the rubber band does not have tension on it, it actually gets shorter. What happens inside the muscles sometimes is they get so short that all the pulling and stretching that you try to impart on it is not enough to get those muscle knots or the fiber bundles to actually lengthen appropriately. So the Theragun G3 PRO works by communicating with the muscles and the nervous system at these very fast speeds and with various points of pressure. Now, as the provider, I can move this around and feel the feedback of what's tight and also watch for the body language if there's any twitching or reaction. Obviously, you can see the rippling effect within the tissue, and it actually looks like waves. The Theragun G3 PRO has speeds up to 40 pulses per second. I can't reproduce that with my hands, and that's one reason why this tool is so effective. And it produces forces up to 60 pounds per square inch. So I can really lean in on muscles that are bigger, bulkier, or even deeper, and a lot of it is based on how the client is feeling during the treatment on the table. I can change my position and I can work on different muscles, and it's all being effective to restore joint mechanics and, like I said, get the flexibility and strength to restore itself. Now, this type of treatment, it's great when we start a session to kind of warm things up in a sense, but it's not as effective when it comes down to problems like adhesions or scar tissue. This is mostly effective when you have muscles that are overworked, they're hypertense. They just feel like the amount of tone in the muscle is more than you really want, because too much tone can inhibit function. So when you do have a problem with adhesions, we're going to use a different technique. And what you see here is instrument-assisted soft tissue mobilization. I am using the Elipse tool to work out issues in the tissues. Now, this is different than the percussion therapy because it's not rapidly beating back and forth. Instead, I'm essentially sliding the tool, scraping along the skin with massage cream, and it's giving me feedback. Now, if I were to just use my fingers to do this, I could be, somewhat effective, but there's a lot of give in my fingertips because of the pads in my fingers. When I use this stainless surgical steel tool, it doesn't give. In fact, it's the person's body that I'm working on that gives. And it gives me feedback about the tissue from the skin all the way down to the bone. And the fascia is really what we're looking for. If there is abnormal binding of that fascia within the superficial or the deep layers, I will feel vibrations, and the client will feel like the bumps. We call them speed bumps sometimes, and this is going to help break up some of that tension. Literally, it's going to mechanically break it up. Fascia can bind down and cause mobility restrictions, pain, and posture imbalances. It's going to stimulate blood flow, and one of the reactions from doing this type of treatment is you're going to get redness. And sometimes if the issues in the tissues are very significant, then you're going to see more than just redness. You're going to see something called petechiae. Petechiae are just like, easy to call it, small bruises that are like pinhole shaped. And it's not really breaking the blood vessels, but it's releasing the tension around the blood vessels, and now there's going to be better circulation, and that's when you start to see the redness, and that's when you start to see the petechiae. It may last for a day or so, but it does sometimes look worse than it actually feels. So the last treatment that you're seeing here is dry needling, and this is to help release stubborn knots and trigger points. I'm working on the pectoralis major muscle, and what you just saw was the client was actually feeling muscle spasms that were actually happening in the moment. He could feel the fluttering of the muscle, and we plan to do this treatment there anyway, so this is good timing. So I'm trying to identify that knot right between my fingers, and I insert an acupuncture needle to stimulate that point. And when that happens, clients will usually feel a twitch, or we'll actually see a visible twitch within the muscle. And then sometimes you'll have some aching, and this all tells you that you're in the right place. Now, when do you do dry needling rather than the Theragun, rather than the instrument-assisted soft tissue mobilization? It all depends on what type of issues there are in the tissues. And while we start to do the examination and we begin treatment, I learn more as we go. The big takeaway here is that all of these treatments stimulate blood flow. Dry needling, probably one of the best ways to stimulate blood flow in a dysfunctional muscle knot, because it gets literally deep inside the body and I can touch it, where the other treatments, they don't get deep and touch that single spot without compressing all the layers above it. This treatment here, the dry needling, it also resets the nerve and muscle connection, which is very important for ultimate function.